Let's go to the last part of what he said in the video where he says, you know, this person's life, you know, that person's this person.
Right.
So when you look at this, what was the cause of death with, was this somebody? Because Sean put that on you.
Put that one on me, right. So here's the thing with Nasser. So the one drug that's probably the single most abused drug in the sport. It across the board. Like, I don't care what sport it is. It could be powerlifting. It's probably, Decade to me is like one of the worst things. It's a safe drug as far as like side effects to the body, but
You forget about the clout, yo. Fuck the word of mouth, yo. Keep your head down, yo. Work until you found, yo. Fight until you make it, yo. Don't think it, no, just take it.
have been an athlete all their life, function somewhere like at that 1,000 range. Now, a non-athlete, just somebody that's going in there, you know, whose level probably tested out at 200, will probably feel amazing at 700.
At 700?
Yeah.
When you say amazing, what do you mean by amazing?
Like just revitalized, like, you know, just feel like, you know, normal again.
Normal again.
Normal.
Okay,
Yeah.
how about the rest?
Trimalone acetate, so that's a fast-acting drug. Most people take that, I say, because most people took that pre-contest. It was something that added hardness to the muscle, but it is something that, it's probably right now the most abused drug in the sport.
This is?
That right there, yes, because of what it does. So it makes you strong, it makes you aggressive, it's the one drug that's probably the single most abused drug in the sport. Across the board. Like, I don't care what sport it is. It could be powerlifting. It's probably
Across the board?
Across the board.
So you were saying professional athletes are using this across the board?
Yeah, without a doubt. And it's fast acting, so it's in and out of the system relatively quick. So you can use it.
Is it water-based or oil-based?
It's oil-based.
Okay.
Yeah.
And it's fast out of your system?
It's very fast in and out of the system. So, but it's also, now there's other ones, so, but this is acetate, so that's a faster acting one. But it, like I said, like it was originally, there was a drug called Phenoject, which is back in the day, which is very similar to it. But this product was, you know, used, you know, back in the day when people were doing things like normal, it was used, you know, last 8 weeks. And now it's probably used almost all year. I guarantee you there's guys that use it all year. Guaranteed.
What are the side effects of this?
That could be anything, like blood pressure is going to be a major issue with Trin. That's going to be, you're going to run into liver and kidney issues with that. Like that's going to be a harsh drug.
Could that kill you?
It could, I mean, most steroids aren't going to like kill you like an opiate would kill you, but there's no doubt that long-term effect of that could eat away
of your
kidney, liver, stomach. It could eat away everything. Like it could destroy your body at a high dose, and that's the problem with that. Like that drug is probably more abused than any other drug on the in the sport, and it's abused at high levels. Because
when you say high, what do you mean by high?
Like, I mean, well, for instance, I would say that people probably, so 75 milligrams is what that is. Mm-hmm. I would say they took that 3 times a week back in the day. So
back in the days,
back in the
80s or 90s?
Back in the 90s.
Okay.
So that would be, you know, what, 225? Mm-hmm. No. I would say they're doing that every day now.
225 a day?
A day, possibly.
You mean the guys on stage?
I would say, and actually here's the thing, it's probably more amateurs than pros. So the amateurs are probably abusing all of this stuff way beyond what the pros are. Because again, the pros have phenomenal genetics, they have people helping them. Like, I can tell you, like, I don't care how many people, like, there isn't anybody gonna, like, prescribe this, like, recommend this for, you know, high dosages year round. Like, nobody. But there are some, like, gym guys out there that will be, because when you take that, you feel phenomenal. So the more of that shit you take, the more you feel phenomenal. You start getting strong, next thing you know, you're benching 500 pounds, you've gained 30 pounds, your muscle looks hard, and you're like, holy shit, if 200 is as good as this, just think what 1,000 is on this. And that's the problem with a lot of the way people think.
How about the
Masterone?
Yep.
It's like Masterone phenylpropionate is something that's taken the last 5 weeks of the show. It's a hardening drug mainly to add basically hardness to the skin. It's literally taken for no more than 5 weeks.
No more than 5 weeks?
No.
How different is that than primobolan?
It's a similar drug than primobolan. There's 2 different kinds of primobolan too, so it would be, the effect of it would be very similar to like the old parabolan or primobolan acetate. Primobolan depot is a slower acting drug, which some people do take in pre-contest, but most people use that. I don't even know if it's even made anymore, but it's a little bit different.
How about DECA? I mean, everybody, for somebody that doesn't know about steroids, they've heard of DECA
DECA
before, right?
is like the original, right? It's like what Arnold and the boys used. It's probably, it's something that I actually don't like. I'm not big on it. A lot of people like it because they think it helps their joints, things, it makes their joints feel. I think the side effects of that is, it's not like harsh side effects, but it's very slow acting. It literally just shuts the body down, like your drive literally drops to nothing.
Once you're off of it.
Yeah, once you're on it.
When you're on it.
Yeah, so you got to take so many different things just to keep your body balanced back out. Like DECA to me is like one of the worst things. It's a safe drug as far as like side effects to the body, but the way you feel on it, like most people that's ever taken it will tell you instantly, like, I hate the way I feel on it.
I hate the way I feel on it.
Absolutely, yeah. And I think because of that, and here we come back to this, so back in the day, that's what they would use. They would take a little bit of testosterone, a little bit of DECA. If you talk to the old guys, that's what they'll tell you, right? They'll tell you, like even back in Arnold's day, that's what we took, right? Now, like they don't go to that. Like they're like, listen, I feel like shit on that, but I can take Tren and feel crazy. I'll stick with the Tren. But it's a much harsher
on your
thing.
body.
And we're being pretty open here. So
yeah, no, that's
like
what I'm asking.
We're like laying it out there.
How about
that's
equipoise?
It. Equipoise is actually very similar to like DECA. It's almost, they're different drugs, but the makeup, the way they respond in the body, almost identical. I like that one though because it doesn't have a lot of the, like, you know, side effects and type of thing, like decreased, you know, that.
How would steroids decrease?
You'll be surprised. So it just literally lowers your. There's so many effects that it has like on it, but the equipoise doesn't. So people will have a tendency to stay away from DECA and go to EQ. But it's also a slower acting drug. So DECA is really slower acting. And most people don't use DECA because it can be detected for so long. So that's why they stay away from it.
Here we go. So this is the next topic, HGH and insulin.
And insulin.
Yep.
So this is where the sport changed, obviously, from like a certain point.
96,
90s
94.
and stuff, yes.
Okay.
And so the growth hormone had always been around. And I think people were using it, but what they didn't realize is how the effect of the two work together simultaneously. And basically the insulin, and the insulin kind of had, like when it first came out, I think that people overdid it. You know, honestly, I do. And I think, like, you know, me and even a couple other, you know, people were kind of the first ones that was like, listen, if you take the insulin every single day, it stops working, like literally. And, you know, there was people I was like, listen, you know, how long have you taken that? And they'd be like, wow, I've been doing it now for 3 months. And I'm like, how much are you taking? They're like, 15 units a day. I'm like, I'll tell you what, take the 15 units and don't eat. Don't eat any carbs. I'm like, holy shit, I'll crash. And I'm like, I'm telling you, you won't crash. And they would call me back and they'd be like, holy shit, like I took the 15 units and I didn't crash. I'm like, exactly, because your body now is used to it. Like your body is literally limiting what the natural production is. And so I think a lot of people, the nutritionists like that knew what they were doing, literally kind of curtailed that a little bit. But up until this point, it has been very, very limited. It was used very like once or twice a week. It was used maybe a couple times after training, you know, a week or something like that, just to make sure that everything was completely loaded, completely, you know, like the body was functioning at 100%, but they weren't like abusing it, trying to force glycogen nonstop. But now there has been a little bit of an, like the protocols that are out there that seem to be floating around are bad right now. They're like really bad.
What's the biggest difference between the side effects of HGH and insulin versus steroids, anabolics?
The totally two separate, you know, things. I mean, obviously steroids are all really based off of testosterone and those types of things, where growth hormone is basically you're based off your growth hormone levels. And insulin is obviously, you know, based off of insulin levels. So they all have a different functioning purpose within the body. Now, obviously, all three together are a very powerful combination. And realistically, maybe one of the most powerful ones is insulin. As when you're looking at, you know, the hormone it could be the most powerful hormone within the body, but it doesn't do legitimately what you think it's going to do. And I think a lot of people, when they first was introduced to it, they thought like, holy shit, I'm going to do all of these things and I'm going to look like Nasser El-Somebody, or I'm going to look like
and
Jay
that's not what's
Cutler.
going to happen.
No, it's not going to happen. Like, they can take insulin all day long. Most of the people that I see that take high doses of insulin just get fat.
Just get fat.
They just get fat, yeah.
You hear about these. Your thoughts on this?
So I hate this stuff. Like, all of the synthol and this stuff, there are some people, I think most people hate it. Like, I can tell you it's the one thing that I hate within the sport. I can honestly say, like, I've never, ever, like, like encouraged an athlete of mine to take it. I've had 2 athletes of mine use it, and it was literally kind of against my, that I don't like it. I think that it is one of those things that we literally have no idea what it is. And everybody's like, it's, you put it in the muscle, it stays in the muscle. There's no chance it can stay in the muscle. I don't care how much of it you pump into the muscle. There's no chance. It has to end up somewhere, and those places have to be brain, lung, heart. If it doesn't clear out of the system, it's going to end up there. It's going to end up almost like cholesterol. Like, so if you've seen an artery that is filled with cholesterol, my thinking is, how is this not binding to it? How is this not binding to cholesterol? And a lot of people think I'm nuts. I know Dave Palumbo is a big, very, like, he's very proactive on this, but he sells it also too. And it's not illegal in any way, shape, or form. But I'm just one of these guys that thinks that it is not a positive for our sport.
Could this kill you?
I think 100% it
Okay.
can kill you.
Is
Like,
there
100%.
stories of that happening or no?
I mean,
in the world of bodybuilding.
They're not necessarily. I mean,
Okay.
there's a lot of stories where people have had trouble with it. I know of a guy that literally had open heart surgery from Chicago that took it, and when they opened him up, they literally had that shit everywhere. Like, it was everywhere. So they're,
Why is it so popular? Why are people like, is it to get it without doing the work? I mean, even some of your guys that did it, they're well-known bodybuilders that use some of this stuff.
Sure, there's a lot of,
yeah.
I mean, that's the thing. I mean, I think a lot of people have done it. I think a lot of well-known people have done it. There has been some guys that have done it that you either couldn't tell, or at least it looked really well. They did it really, really well. I think those are far and few between.
Okay.
I think that there's very few guys that can do it.
The reason why you are here after the response we got with
Sure.
Sean, and we're getting a
Sure.
little bit deeper in this topic. So
Sure.
now, let's go to the last part of what he said in the video, where he says, this person's life, that person's this person.
Right.
So obviously these are some names here. We'll go through them together. You obviously know who these are.
Right.
Munzer, El-Somebody,
Nasser, for sure.
Matarazzo, and then we have some other guys here we'll get to here in a minute.
Okay.
So, when you look at this, what was the cause of death was somebody? Because Sean put that on you.
Put that one on me.
Yeah.
Right. So here's the thing with Nasser. So